there are some differences between men and women in terms of the way they present with heart disease and in their risks at different ages. Women tend to have less typical symptoms than men, sometimes very atypical symptoms, strange kinds of chest or arm discomforts or back or neck discomforts. You need a higher degree of alertness with women than you do with men, particularly depending on their risk factors. The more risk factors they have, the higher your alert status should be with women. Men tend to present more typically with classic symptoms. However, 25% of the general population and 40% of diabetics don't have to have any symptoms before they get into trouble, first of all. And even when you find out that they have a problem or have trouble or have had a heart attack and you ask them in retrospect about their symptoms, 50% of those two groups can't even remember when they might have had their heart attack. Women also tend to have more advanced disease by the time they present to the doctor, and they tend to have smaller arteries, which tend to be less amenable to the usual treatments such as angioplasty and stenting, and maybe in certain subgroups, particularly female diabetics, respond better to bypass surgery, even though it's more drastic than angioplasty or stenting.